Welcome to the deep dive. This deep dive is adapted from a clinician-written article on Mentalyc and brought to life in audio for therapists like you who, might prefer listening to clinical insights on the go.
And today, we're really excited to feature the perspective of Sylvie Saxena, that's MBA, LSW. She's a certified clinical trauma professional and a licensed social worker practicing out of Philadelphia.
Yeah, and her work in complex psychosocial care, it just really grounds the insights we're going to be getting into today.
It really does.
And since this piece does come from Mentalyc, it probably helps to know that they're a clinical intelligence platform. They're basically designed to support therapists with documentation and what I think is critical with that often overlooked need for deep clinical reflection.
Right. So today we're diving into what is really the foundational glue of our work, therapeutic rapport.
Let's start with a scenario. I think it's one we all recognize.
Okay. So you're sitting across from a client,
Yeah.
and they carry this long history of relational trauma. Maybe it's chronic betrayal or just devastating inconsistency from their primary caregivers.
And that history, it doesn't just disappear when they walk into our office, right? It's actively present in the room with you.
Probably so.
They might be guarded, maybe holding back really vital information, or even consciously or unconsciously testing the relationship.
Yeah, testing to see if you're going to be just as unreliable as everyone else they've ever known.
Exactly.
And that guardedness, it acts like a friction burn on the early process of building trust. It just makes the essential work so difficult and so slow.
So the real challenge for us then is how do we maintain that clinical consistency, that attunement in those tiny fleeting micro moments, especially when we're managing just a sheer volume of emotional and historical data.
That is the core question.
And I think that's where Sylvie's article gives us such a strong anchor. She emphasizes this core insight that the quality of the therapeutic relationship, including that rapport,
That foundational rapport,
is one of the strongest predictors of positive outcomes. But what's fascinating, and what the data suggests, is that this often matters more than the specific modality.
Right. More than whether you're using CBT or EMDR or a psychodynamic approach.
It's almost like the technique is only as effective as the container that's holding it.
That's a perfect way to put it. Rapport isn't just friendliness. It's the engine of transformation. It's the secure container that allows challenge and change to actually happen without the client, dissolving or shutting down.
Okay, so if we accept that, it really shifts our focus, doesn't it?
How so?
Well, we move from asking, am I using the right intervention, to asking something more like, is the relationship strong enough to bear the weight of this intervention?
Yes.
Can you give us a quick example of how an intervention might just fall flat if that rapport is missing?
Sure, certainly. Imagine you have a client who is really struggling with self-criticism, and you attempt a very high-structure cognitive behavioral intervention, like a thought record, maybe right out of the gate.
Okay.
If they don't trust your motivations or if they perceive your framework as rigid and judging, they might do the homework intellectually, but they won't internalize the change.
They'll feel exposed or assessed.
Exactly. Assessed rather than supported. The whole thing backfires.
That makes perfect sense. And the article highlights that rapport is both a science and an art. Let's maybe start with the science part, which seems to be rooted in consistency.
Yeah, the science is all about reliability. Things like consistency and reliability. They're these silent reinforcements of trustworthiness.
You mean the simple stuff, like showing up on time?
Showing up on time, maintaining clear professional boundaries, following through on what you say you'll do. All of that offers this profound, almost somatic reassurance, especially for clients who've only ever known chaos in relationships.
And then the art of rapport. That's where we get into seeking to deeply understand the client's past, right?
Precisely.
We're not just treating a diagnosis. We're sitting with the person who brings decades of attachment history and all these prior experiences with vulnerability into the room.
Yes. And understanding their attachment history is it's crucial.
Yeah.
Because it gives us a kind of blueprint. It helps us anticipate how they might respond to closeness or to challenge or even to our perceived authority.
So an anxiously attached client might seek validation constantly.
Right, while an avoidant client might pull back at the exact moment you try to deepen the connection.
Okay, but if we acknowledge that every session brings these subtle shifting signals, the micro expressions, the little hesitation in their voice, that slight withdrawal.
All that data.
How do we possibly track that level of nuance across an entire caseload week after week? I mean, that consistency feels almost impossibly difficult to maintain.
It is. It really is. And this is where we can sort of bridge the art and the science with some support tools. The article points out the utility of Alliance Genie.
Elias Jana.
We know that maintaining consistency is the hardest part, and sometimes our own blind spots get in the way. It's just human.
So Alliance Genie, which is integrated right into the documentation process, you're saying it's designed to act like supervision, but inside your notes.
Exactly. It's there to help you reflect on the session by tracking those subtle alliance signals. It can capture where the rapport felt strong, maybe flag potential ruptures or areas for growth.
So it's not replacing your judgment.
Not at all. It supports the clinician in managing both the art and the science. It's an assist for reflection, for self-supervision, really. It helps you spot those subtle dynamics you might have missed while you were, fully focused on being present with the client.
And that external reflection is so vital because even with the strongest rapport, we know that relational ruptures they're just inevitable. We're human.
Inevitable, yes. And the source material really stresses that the rupture itself, that moment of misattunement or disconnect, is actually less important than the skill of the repair.
This is where the deepest healing can happen, isn't it?
Oh, absolutely.
For clients who have only known conflict that leads to abandonment, or just that awful unresolved silence, a successful repair is a massive corrective emotional experience.
It's intensely healing.
Yeah.
And skillful repair, it requires humility. It means openly acknowledging the rupture, taking genuine accountability for your part in it.
Even if your part was just being misunderstood.
Exactly. And then, crucially, inviting the client to share the impact that rupture had on them.
But isn't that the hardest part for us as clinicians? To face that moment where we might have failed a client's need and to resist that very human urge to defend ourselves.
It requires a huge amount of self-awareness and regulation, no question. But when you can move past that defensive posture and say something like, I recognize my comment landed differently than I intended, and I really want to understand what happened for you in that moment.
You actively strengthen the rapport.
You do.
Yeah.
You demonstrate that the relationship can survive conflict, that you, the clinician, are reliable enough to admit when you miss the mark.
That kind of reliability, it goes way beyond just showing up on time. It's true emotional dependability.
It is. And speaking of showing up fully, rapport also demands deep cultural humility.
Ah, yes. This is so important.
The therapist has to acknowledge and honor the client's lived experience. You have to recognize how their culture shapes expression, how they interpret help-seeking, and just how they engage relationally.
So we have to actively work against making assumptions, which means sometimes being transparent about our own limitations and our own biases.
Yes, because if a client feels they're being filtered through some clinical or cultural stereotype, that rapport just instantly dissolves.
Right. If they perceive their identity as being pathologized or that their cultural norms are being framed as, say, resistance or defiance, the relationship is irreparably harmed.
It's a constant process of checking ourselves, making sure we are honoring their experience as unique and not trying to fit them into some preconceived box.
That reflective practice is continuous. Now let's talk about the structural support for a minute. Boundaries. I love how the article frames them as essential supports that protect the rapport.
The analogy of frames, not walls, is perfect.
It is.
Because holding boundaries with compassion but also with firmness, it signals reliability and deep care. For a client whose past was just chaos and inconsistency, the firmness of a boundary,
whether it's about time or contact outside a session,
or financial expectations, that provides a really secure framework for them.
And when a client tests a boundary, which, it so often happens unconsciously as a search for safety, holding that boundary consistently rather than bending or collapsing is paradoxically a massive rapport builder.
It is. It reinforces that thought. This space is predictable. I am safe here.
It answers their safety-seeking question. They asked, are you reliable?
And the boundary provides a clear, consistent yes. This dependable framework is what allows us to move into the deeper, more vulnerable work later on. If the container leaks, the content will spill out.
That's a powerful way to summarize it. Whether you're working through a rupture, navigating cultural humility, or setting a boundary, every single action is a relational investment.
It is, and it brings us back to how complex it is to track all these elements in the rush of weekly practice.
This feels like a good place to just pause for a second. If tracking all these alliance patterns, this consistency, these subtle relational nuances feels complex, and let's be honest, it is, especially across different modalities and with the sheer volume of notes we write, Mentalyc can help.
Its Alliance Genie feature supports your clinical reflection and your judgment, and it stays fully IVP and SOC2 compliant. You can explore how it works at Mentalyc.com.
So shifting now to more of the practical application, the article gives some really excellent guidance on building rapport, and I love this idea of starting with humanity, not pathology.
This is so vital. It means not rushing into the clinical assessment or the diagnostic checklist. It's about establishing the client's agency and their ownership right away.
You're signaling, I see you as a person first and your problem second.
Exactly.
And the source material gives these specific conversational touch points that encourage that ownership and normalize hesitation. It's not about a script, it's about the intent behind the words.
Right. For instance, instead of immediately diving into the chief complaint, you could start with something as simple as, before we get into anything deep, how's your week been?
That simple human gesture, it just opens the door to a genuine connection before the work even begins.
And then inviting their voice into structuring the space right away. Validating their agency with a question like, what would make this space feel most supportive for you today?
That puts the power back in their hands. And for so many clients with trauma histories, that can be a deeply disorienting, but also incredibly healing experience.
And normalizing the emotional discomfort is huge for rapport. Something like, it's okay if things feel messy or unclear. That's part of the process.
You're giving them permission to be imperfect in the relationship. You're signaling that the relationship itself is unconditional. So the overall message here is clear. Building rapport requires consistency, humility, firm boundaries, and this real unconditioned warmth. It's an active process of managing both the external mechanics and our internal reflection.
Absolutely. The big takeaway is that investing in rapport is not some preliminary step you take toward the work. It is the work.
It is the work.
And when that relationship is strong, when it's secure, that's what unlocks the possibility for deep, enduring, and truly life-affirming growth.
That's a powerful summary. And for clinicians who are seeking that extra layer of support in tracking those crucial align signals and reflecting on consistency across sessions without ever storing any audio alliance, Genie can provide some really meaningful insight.
It just helps us refine that essential art and science of connecting, making sure our relational efforts are both targeted and consistent.
So, here's a final provocative thought for you to sit with this week. If rapport truly is the strongest predictor of outcome, how does our own ability to tolerate a client's resistance or their silence, which the source says is sometimes needed when rapport is challenging to build, how does that directly correlate to our own comfort with relational uncertainty?
That's a powerful question.
It is. A good question for all of us clinicians to sit with as we reflect on our own practice this week.